welcoming your guests. We have examples of new patient packets from Dr. Katz's office. We're going to pass those around now. These can be snail mailed, or you can create an electronic version of this. They can go out to the patient prior to their visit.
I'll send one up each side, you can just take a look.
This sets the tone for what they can expect when they come to see you. It also gives them an opportunity to fill out their health histories at home, where they have their list of medications and they're comfortable and they have their cards and all that stuff handy. We also encourage all of our clients to do a pre-appointment phone call from the doctor. So every night, we want to give the doctor or doctors a list of the new patients that are coming in for the following day. And Dr. Katz, I'll let you do the script that you do on the pre-appointment phone call.
Okay. Hi, Mrs. Jones. This is Dr. Katz. I'm the dentist that you're going to be seeing tomorrow for the first time. I always like to call patients the night before the first visit, just to introduce myself and to find out if there's anything in particular that's concerning you before you come to your first visit. The immediate reaction you get is, wow, I've never gotten a call like that before. They rarely ask any questions at that point. They might say something very cursory, but they really don't ask that much. They're just too impressed with the fact that they got this call. The advantage of the call, how many people have problems with new patients not making their appointments, not showing up? Anyone here? I see a lot of heads going up and down. Well, the reason new patients don't show up for an initial visit is because they don't have a relationship with you. So there's no connection. They don't feel that they're committed to you in any way. If the doctor calls them the night before their first visit, they immediately have a connection, a relationship, and they're less likely to disappoint that relationship. Relationships are important to people. Other thing is, oftentimes when I call, we get the answer machine, or we get a voicemail, and that's okay. The exact same script that I use when I get the person on the call is what I leave on their voicemail. And inevitably what happens when they come in the next day, they say to somebody in the office, I can't believe the doctor called me tonight for the visit. It's just part of that connection, that emotional connection, that communication that creates believability, likability, and trust, the BLT sandwich, before they come in, and it starts that relationship on the right track.
So when that patient does walk through the door, we all know that he or she is coming because they're on our schedule, someone spoke to them, we know their name, so we want to be incredibly prepared for their arrival. And the people that are working in the administrative area at the time that the new patient is ready to arrive, someone should be in charge of being ready to greet that new patient and not be doing anything else during the window of time that the new patient should be arriving. The reason why we want to do that is we want to be able to treat that new patient as if they are a guest in our home. And when most of us, I hope, if I were to come to any one of your homes as a guest, I would hope that you would not sit behind a wall this high and look up over and go, I'll bring your paperwork out in a minute, and not barely acknowledge me, or maybe, God forbid, I hope in your homes you don't have like a window that I have to slide open to say hello to you. If any of you have that window, please take it out. Throw it out Monday morning.
Or we'll come in with a sledgehammer.
Yes, definitely. So I would like to encourage all of you to try this if you're not doing it already. Greet the patient by their name. Jump out from behind that wall. That wall's a barrier. It's causing a disconnect between us and that patient, preventing us from building a relationship with them. Jump out from behind that counter and come out and say, Rosemary, I'm Kelly. We spoke on the phone. I'm so happy that you're here. I'm going to show you around in just a moment. I'm going to have you fill out some paperwork. But first, can I get you anything to drink? Would you like a beverage? Okay, great. Let me get you some water. Make yourself at home. I'll be right back with some water for you. You're going to start this off like they're a guest in your home. First, make sure that all of their needs are met. They're comfortable. Take their things. Give them a drink. We're going to go ahead and take them on the tour of the office, benefit-oriented, as we talked about. We're going to have something called the 10-foot rule, or in smaller practices, the 5-foot rule. If anyone on the team comes within 10 feet of that new patient during their visit, they need to say hello to them and reference them by name. We all know they're coming. That's a huddle agenda item. In the morning, everyone needs to know who the new patients are and what their name is. Also, we want to try to, if the facility allows, have a private office consultation room, or even the doctor's private office for the patient to go in and fill out their forms if they have not done so already, so that they're not sitting with a clipboard on their knees, which is not fun, it's not luxurious, it does not make people feel special, it's uncomfortable, it's annoying to fill out your paperwork on your knees on a clipboard in a chair that might not even be that comfortable to begin with.
Doctors, your private offices can be the most productive room in your offices, providing you clean all the piles of crap off of it so that patients can sit in it and feel that they are welcomed into your office, any place in your office, so that you can have constructive conversations with them. Because 95% of the time, that office is not being used and it's useless. And it's not important if you can play video games or do words with friends. And it's more important that that office is functional to deal with patient relations and inspire patients to proceed with treatment and to create relationships. So clean the stuff off your desk and make it so that a patient can sit in there and be impressed with your plaques on the wall, the certificate that you won, and maybe lists of continuing education that are framed behind your desk.
So we're going to move into the interview. After the patient has had an opportunity to fill out their forms, we would like to have an administrative person come in and go over the forms with them, ask them if they need any help filling it out, do they have any preliminary questions, and basically just start to get to know them a little bit. Once that has happened, we want the doctor to come in on cue without making that patient wait 45 minutes into that private consultation room with no interruptions. There should not be a phone that rings in that room during this time. You are not going to leave the room, doctor, for an exam. You're not going to take a phone call. That's it. This is no interruptions.
And I'll be honest with you, I don't even schedule anything for when my team members are in the consultation room with the patient. I stand outside the room and I listen in, because I want to get some idea of what the hot buttons are for that patient. What are the emotional things that they're bringing up with my team member that I can cue into when I start addressing what the perceived needs that they have and try to help develop those needs to become wants of dentistry. So I'm listening outside the door and waiting for the cue for when I'll come in and have my team member introduce me.
So some of the obvious things that we're going to talk about is why the patient called. Then we definitely want to ask them things about themselves and their occupation or their family life, or things that may become important to us in planning their treatment and deciding how we may want to accommodate them, if need be, so that they can get the treatment done around their work schedule or other challenges that they may be facing, and get to know a little bit more about them and where they're at in their lives, which is very important. Steve's going to talk more about that in a bit. And then we have something called SWOT questions. And SWOT is strengths, weaknesses, opportunities, and threats. And these are some of the most powerful questions that you can learn in dentistry and actually in communicating. So in that scripts book that we described to you, those techniques are in there. So if you're interested in learning more about that, please do request that. And then obviously we want to review their medical and dental history with that.
Question we always get is, how much time do we allocate for a new patient appointment? The first appointment in our office is an hour and a half. It's usually 10 or 15 minutes with a team member in the consultation room. Then it's about 15 or 20 minutes with me in the consultation room, just talking, creating a relationship, finding out information about them, things that I can relate to, things that they can relate about me. Remember, reminding them what we believe in, because they're going to buy what we believe in, not what we do. Asking them the SWOT questions, and I will go through that as well, seeing what they liked about previous offices, what they didn't like about previous offices, developing that relationship so that we can proceed and we're going to talk a little bit later about what patients are really looking for when they come to us.